Publicly funded schools from March 14th, 2020 through to April 5th, 2020.
A major development for students and parents across the province. Ontario's publicly funded schools are shutting down over COVID-19 concerns. Word of the closures coming just in the past hour from the Education Minister. Kelda Yoon joins us live outside Swansea Public School tonight. And Kelda, after tomorrow, schools will be closed until April 5th.
That's right, Chris. From March 14th all the way to April 5th, so all schools, all public schools will be closed. That's a full 3 weeks, including March break next week. Now, this, as you can imagine, will affect a lot of families. The closures will impact about 2 million elementary and high school students across the province. The government says the decision was made on the advice of Dr. David Williams, as well as other health experts, as a necessary precaution to keep families safe from COVID-19. Now, Education Minister Stephen Lecce addressed this decision about an hour ago.
We have a decision point before us on the advice of Ontario's Chief Medical Officer, who has said that schools should close for a period of 2 weeks following March break because of increase of travel that is normative during this time of year. That is a prudent step, one where we recognize the difficulty it imposes. But our commitment, and I think a shared commitment, including of parents, is to do everything we can to ensure the safety of their children, given the vulnerability of young people and staff.
I've been speaking to some parents here outside Swansea Public School as they were coming to pick up their kids from daycare as well as kindergarten. Most of the ones I spoke to, they were surprised. They did not think that it would come to this. But at the same time, the ones I spoke to are also taking it in stride. But of course, at the same time, they will now have to look for extra childcare for a few more weeks. So that's, of course, causing a little bit of anxiety for a lot of parents as well.
We don't know what we're going to be doing, actually. It's a little bit concerning, but I mean, when you think about everything that's going on, the safety of the kids, like, so we feel it's, I don't know if it's a good thing or a bad thing. It's really hard to say.
If that's a decision that's got to be made, it's got to be made. What are you going to do? You just got to deal with it. It could be worse.
Surprised, but I'm glad that they're taking every precaution, so that's good, yeah. I really haven't thought about what we're going to do for those additional 2 weeks, but well, I guess we'll have to figure something out.
Now, here at Swansea Public School, there is a daycare attached. It's not known yet if that will close. And some parents I spoke to today, they were a bit concerned. They haven't heard yet whether the daycare will close. Now, Dr. David Williams, he had mentioned in his recommendations, or implied in his recommendations, that he advises that daycare is also closed for the full 3 weeks, just as schools are closed. But ultimately, that is up to the daycare operator to make that decision. Also, meanwhile, the Elementary Teachers Federation of Ontario, they have announced they will be suspending rotating strike action that was scheduled to begin on March 22nd. I'll send it back to you, Chris.
All right, so much to watch. Thanks so much, Kelda.
Yeah.
Another bit of news breaking late today. When Catholic school students go back to school in April, their teachers may be closer to a brand new deal. A tentative deal has been reached with the Ontario government on a new collective agreement. The union says effective immediately, all strike action is suspended. Teachers will vote to ratify the agreement on April 7th and 8th. Terms of the deal have not been released. OECTA is the first of Ontario's 4 teacher unions to reach a deal with the province. Let's get back to the latest on the COVID-19 situation and the response here in Ontario. Health officials today saying there are now 17 new cases of the virus in our province. Lisa Shing is live tonight at Queen's Park. And Lisa, what are officials saying about today's jump in the number of COVID-19 cases?
Well, certainly a bit of a change in tone today from Ontario's medical officials. They were a little more decisive in suggesting that people should avoid all non-essential travel, and this is all coming out of that spike in cases we saw.
We were getting, lab reports every few minutes. It was, concerning.
Ontario's medical officers of health explain what prompted them to suggest people avoid all non-essential travel out of the country.
We feel that at this point we have to act more decisively to protect the health of the public.
And for parents who are still taking their children on vacation for March break,
when you come back, you're going to be asked to keep the children out of public settings.
This as Premier Doug Ford headed to the capital today for a meeting between the Prime Minister, premiers, and Indigenous leaders on COVID-19.
We are here at a critical time, not just for Ontario, but for the whole country.
So that's Sophie Gregoire Trudeau.
But shortly after, the meeting was called off because Justin Trudeau and his wife were in self-isolation. So are many others. More than a dozen new cases in Ontario today, including a 1-year-old boy who was in close contact with another patient and attended North York General Hospital. Ontario's health minister announced more details about assessment centres for the virus.
It's really meant to take the pressure off the hospital emergency departments and to keep the people who may have COVID-19 separate from the general hospital population.
6 centres will open in the coming days, including at Brampton Civic, North York General, Scarborough Health Network, Trillium Health Partners in Mississauga, Mackenzie Health in Vaughan, and the Ottawa Hospital. More will open in the next few weeks. Ontario has also allowed doctors to do more assessments over the phone. And in the next few days, the province will also launch a website that will walk people through how they can get medical care based on what they need. And of course, some of these suggestions we just heard from these health officials could change at any time, considering the situation is quickly changing as well.
And Lisa, we also know that there are some developments about the Ontario legislature itself. Tell us about those.
Yeah, so late this afternoon, the government passed a motion that would allow them to suspend the legislature without actually having to officially prorogue. And considering next week is March break, that could mean if the situation worsens, that break could be extended for some time.
Thanks for this tonight, Lisa. You may have noticed a box in the lower right corner of your screen. We've put in there information that public health officials say is critical during the outbreak, including the symptoms, tips for protecting yourself, and defining things like social distancing. It'll be up during all of our COVID-19 coverage tonight. Now, speaking of social distancing, another sweeping impact of COVID-19 is the cancellation of multiple public events. From pro sports to the Juno Awards, organizers are taking bold steps to prevent large crowds from gathering. Many health experts say it's a crucial step in containing the spread of the virus. They're also warning our governments and the people advising them to be bolder. Lauren Pelly joins us live now from Scotiabank Arena. And Lauren, that building could be a bit emptier for a while.
It certainly could, Chris. And we're also learning tonight that other governments across Canada are taking quite bold steps to ban certain types of events outright. They're looking at, in Alberta and Quebec, exploring banning events over 250 people. Now, this is not the approach that's being taken here quite yet. Right now, it's individual organizations and sports leagues that are looking at canceling shows, events, and big mass gatherings, which is why you could see this arena empty or fairly soon. But public health experts are saying, you know, this is the right approach for now. But there are some other doctors who believe that we need to be bolder and taking these steps sooner to prevent a spread of this virus.
Multiple sporting events all on hold. Major League Baseball, soccer, the NHL, and the NBA are all suspending their seasons. Sports fans are in support.
Can't pretend to be disappointed, but at the same time, people being sick over the sake of a hockey game, got to shrug your shoulders and get on with it, haven't you?
Yeah, we've been waiting for months to come down here, so we had our fingers crossed hoping that it wouldn't be canceled. And we didn't know until we got here that it was.
We were hoping to squeak the game in. Kind of had a feeling that it would be canceled due to the NBA, but...
Then there's the Juno Awards, canceled. And Toronto's annual St. Patrick's Day Parade, not happening.
Event organizers and businesses can also do their part in reducing virus spread by promoting social distancing measures.
Social distancing means avoiding big crowds and generally keeping away from others, which could mean skipping events or working from home. Toronto's medical officer of health is calling on all organizations to consider postponing events or holding them virtually. But city officials aren't canceling their own March break camps just yet and stopped short of calling for a full event ban.
Bans are fairly blunt instruments.
No word from the province on that front either, even as screening is ramping up and school classes are being canceled.
It's actually industry leading the way.
This infectious disease specialist says governments need to act faster too.
The just mathematics suggests if you're going to do this, you have to do this sooner rather than later. And so what I'm looking for from different levels of government is really clear voices about social distancing.
So as we're hearing that debate play out in Ontario, we've also learned that Live Nation, which is a big events company, they're looking to cancel all their major arena shows until April. So another instance of a local organization stepping up and making a change here. While, as you heard, experts are saying that they need governments to actually be leading this charge. Otherwise, this situation could get worse. Chris?
It'll be a very different world for the next few weeks. Thanks, Lauren. Now, as Lisa mentioned just a couple minutes ago in her report, the COVID-19 pandemic is impacting the highest level of our government tonight. Prime Minister Justin Trudeau and his wife Sophie are in self-isolation. She began showing symptoms after a recent trip abroad. Their isolation forced the cancellation of today's First Ministers' meeting in Ottawa.
I gather we may be meeting with the premiers and the Prime Minister by telephone tomorrow, but that's just an indication of how quickly events are developing. And so we are all rightly concerned about the global crisis that we are facing.
So the First Minister's meeting had already been scheduled. Its focus had become Canada's response to the pandemic. But after the latest news of the Prime Minister and his wife, the session was postponed indefinitely. The Trudeaus will remain at home to wait for Sophie Gregoire Trudeau's test results. The Prime Minister himself is not showing any symptoms of coronavirus and is continuing briefings and calls from home. Starting tomorrow, people from the 26 European countries will be banned from entering the U.S., and Americans traveling back will be subject to quarantine. Salima Shivji is in Washington with President Donald Trump's controversial COVID plan.
My fellow Americans,
an announcement from the president that not only shocked, it also confused. Today, the vice president set about explaining what the travel ban actually means for Americans.
Americans coming home will be funneled through 13 different airports. They'll be screened, and then we're going to ask every American and legal resident returning to the United States to self-quarantine for 14 days.
Donald Trump called it a foreign virus and pointed the finger at Europe for not tackling the outbreak more effectively, leaving the European Union fuming. It says this is a global crisis that demands global cooperation.
The U.S. decision to impose a travel ban was taken unilaterally and without consultation.
The president today defended the travel restrictions and said he had to make a decision fast.
I don't want people dying. That's what I'm all about. I made a very tough decision last night.
Even as questions swirl about how effective travel bans are now when the virus is already spreading fast inside the U.S. The Trump administration has been criticized for lagging behind in testing for coronavirus. Today, as Trump said, they've done a good job on that front. The country's top infectious disease specialist directly contradicted that.
It is a failing. I mean, let's admit it.
Lawmakers here are still negotiating over what to include in an economic relief package for those affected by the virus, just as Americans adjust to a new reality to avoid infection, with more schools closing, sporting events on hold, and more states banning large gatherings. Salima Shivji, CBC News, Washington.
Next up, the continued barrage COVID-19 is having on stocks and your money. The TSX closed today with the biggest loss in recent memory. Jeannie Lee is on the market meltdown for us tonight. And Jeannie, what do we need to know today?
Well, I was going to say, Chris, think back to what you were doing on October 19th, 1987.
Okay.
We have to go back to that date to have this record that today was shattered. 32 years ago, on Black Monday of 1987, the market in Toronto lost more than 11%. And for the last 3 decades, we've been pointing at that as the worst loss in recent memory. Well, today changes all of that because we did have the biggest loss to beat that. About 12% drop on the TSX Composite, 1,761 points gone just like that, bringing the index down to 12,508 when just weeks ago it was heading for 18,000. So the total loss so far since this coronavirus-led sell-off began, we're looking at a loss of more than 30% in 3 weeks. So when I say Throwback Thursday, that was 3 Thursdays ago.
Wow, that's incredible. And what we're learning is, of course, this is due to COVID-19, but where are we getting all this pessimism from?
Every single bit of news that comes along. You know, what did you have today? You had the NHL suspending its season. This is after the NBA suspended its season. This is after Tom Hanks said, hey, I've tested positive. Suddenly, for everybody that was thinking, you know what, this coronavirus is not a thing, it's now become a thing. And that's what suddenly, you know, you have people who were thinking we can ride this out, maybe panicking a little bit and saying, nope, I'm out of here. And I'm just talking, you know, very colloquially about the forces on the stock market. Of course, there are things that are bigger, forces like how the U.S., President Donald Trump has the resources and the power to make plans to combat coronavirus and also to combat the negative effects on the economy. And everybody was watching the White House last night, looking at the details of this plan that might avert a global recession or a slowdown. And they didn't seem to get it because the negativity started right then and escalated through the day with all of the bits of bad news. You know, that's why we had one of these biggest losing days. The Dow, for example, lost the most it ever has in points.
Wow, it's just incredible stuff. Thanks for tracking all of it for us.
All right.
We have much more on the coronavirus outbreak. Later, we'll take you to New York, where it's lights out on Broadway, and to Italy to look at what life is like under its nationwide lockdown. Plus, what is it like to get a test for COVID-19? Our reporter undergoes the screening that you may have to take in order to find out whether you have the virus. That's coming up at 6:30. Remember, you can find the very latest on the coronavirus online at cbcnews.ca. Colette Kennedy is here with me now. And Colette, let's take a break from the COVID-19 talk for a quick minute here to catch us up to speed on the weather.
Yeah, I'd be happy to do that, Chris. A lot to digest today in the newscast, so let's take this moment. We will look at the weather, and I do have to start off with telling you what's going on in terms of watches and warnings. Just one I want to point out here. See this little orange area here? Wind warning. That's to the east of us, well to the east around Picton, where tomorrow those winds may exceed 90 kilometers an hour. The other areas you see here in blue, so to the north of the GTA, to the east, special weather statements in place. The one to the east for rainfall, 15 to 25 millimeters through Friday. And then to the north of us, it has to do with these winds that we'll be seeing as this system moves through tonight. So we're talking about the winds there perhaps exceeding 70 kilometers an hour, something to be mindful of mostly during the day. We're talking about on Friday. So let me just show you what's happening now. The moisture is off to the west of us, but there's some also to the south, and the system kind of comes together. However, it moves pretty quickly through. So we'll see rain filling into the GTA, maybe some isolated showers towards 11 or late evening, but most of it coming through after midnight. About 5 millimeters is all we should see for the GTA. It's enhanced to the east, a little bit of mix to the north of us on the backside, but those winds will really be picking up, and so we're going to be seeing those winds perhaps up to 40, 50, even 60 kilometers an hour at times through the day tomorrow, even in the GTA. Temperature 4 degrees, kind of holding. We're at 5 now into the evening. We rise overnight. Tomorrow morning, we hit the high for Friday, 8 degrees. And then, Chris, the temperature falls through the day with those blustery winds from the west, but we may get some sunny breaks as things wear on. I'll have the weekend forecast coming up.
All right. Thanks, Colette.
You're welcome.
The weather update is brought to you by Train, the most reliable heating and cooling brand. It's hard to stop a train.
Still ahead, the latest from the Tess Ritchie murder trial. The accused, Kalen Schlater, was back on the stand today. Plus, Natalie Nanowski has been working on a story about a TTC driver in trouble.
Natalie.
Oh, sorry. I was just playing a game on my phone.
Probably not the best thing to do while you're on the job, especially if you're driving a bus. One TTC operator has now been suspended for using his phone on the job. I'm Natalie Nanowski, and I'll have that story coming up.
The defense team for the man accused in the murder of Tess Ritchie is questioning a person they say is the real killer, not their client, Kaylin Schlater. Ali Chiasson was back in the courtroom as Schlater's first-degree murder trial continued today.
Defense suggests the man they say really killed Tess Ritchie was out prowling for sex at 3 a.m., the same time Tess Ritchie was out with her friend Riley Simard and the man she had met outside a bar, Kaylin Schlater. We can only refer to today's witness as JG. His identity is protected by a publication ban. The defense asks JG about an interaction he had with Ritchie the night she died. He was taking money out at an ATM on Church Street when he heard Ritchie call out to him. She was standing arm in arm with Simard and Schlater across the street. JG. She initiated the conversation with me. She'd say, hey, hello? Hey, I want to talk to you. Defense attorney Lydia Riva. Why did you think she wanted to get your attention? JG. I don't know, maybe she was just interested in talking to me. JG described seeing Ritchie being pulled on either arm by her friend and Schlater. They wanted her to go in different directions. JG describes it as a tug of war and found it odd. But JG said he was interested enough to see if Ritchie was actually interested in him. So he caught up with the group by cutting through an alley. I didn't want to seem like I was following her or luring her. When he eventually crosses paths with them again, he said Richie called out to get his attention a second time, but Simard and Schlater discouraged her, saying things like, quote, "Don't go with him, don't talk to him." JG says he went home after that. But as their alternate suspect, the defense alleges JG went to the stairwell and killed Richie after Kaylin Schlater left. Defense attorney Lydia Riva, "You assaulted her and there was a struggle and you killed her, right?" JG, "No, ma'am." There was no physical evidence like JG's DNA found on or near Tess Ritchie's body. The Crown continues their cross-examination tomorrow. Ali Chiasson, CBC News, Toronto.
Now to a TTC driver who has been suspended after a passenger caught him playing a video game while driving a bus. Natalie Nanowski has the details.
Look closely. The bus is moving, while in the driver's hand, there's a phone, and he's swiping at the screen. Not something most TTC riders want to see, ever.
It kind of make me feel unsafe because while driving, you cannot use your phone. That's the rule.
I've never actually seen anything like that, and the fact that he got caught doing it, I think that's I'm happy somebody recorded him.
Corey Zirk captured the video yesterday evening when he boarded the Sherbourne bus. He noticed the driver kept looking down at his lap.
I looked down and saw his phone in his hands. At first I thought maybe he's just replying to a text, maybe his kid's sick, or then I saw what looked like colors coming across the screen, and it became apparent that he's sitting there playing a game in traffic.
That's when Zirk took out his phone to film what was going on.
To have a professional driver sitting there playing a game while in traffic, moving, nonetheless, is absolutely appalling.
We've seen the video. It's very concerning to us.
This morning, the driver was suspended. It's not the first time a driver has been caught using their phone. This video from 2016 shows a driver texting. And in 2011, the TTC fired 3 people for handling their phones while operating a vehicle. So termination isn't off the table this time around.
We'll be reviewing this incident, and there will be consequences.
In a statement, a rep for the transit union told CBC that safety is of the utmost importance and that its drivers get Torontonians safely to and from their destination each day. It also said that it's closely monitoring the TTC's investigation. No word yet on when that will wrap up. Natalie Nanowski, CBC News, Toronto.
After the break, we return to our top story and the latest on the coronavirus pandemic. We'll take you to the U.S., where there's confusion and panic after a flight ban to and from Europe by President Trump.
We have to leave now because we are expecting the collapse of the transportation flights, and we are afraid to not go home, so we cancel everything.
Plus, what's it like inside the lockdown in Italy? Those stories are coming up for you next.
issued a ministerial order under the Education Act to close all publicly funded schools from March 14th, 2020 through to April 5th, 2020.
We have at this point a total of 59 cases that have been reported.
COVID-19 concerns leading the education minister to give the order that after tomorrow, schools in Ontario will close until April 5th. Meanwhile, 17 new cases of the disease have been reported in Ontario over just the past 24 hours. Provincial health officials also recommended against gatherings larger than 1,000 people, but Mirvish Theatre Productions will go on. On their website, Mirvish wrote, "We take our lead from Toronto Public Health, who are in constant consultation with their federal and provincial counterparts. At this time, Public Health has stated there is no evidence of community spread in Toronto. Our performances are continuing as scheduled." Meanwhile, the old saying that the show must go on won't be true on Broadway tonight or any night until at least mid-April. The center of the New York theater industry was closed today after the state's governor put a ban on all gatherings of more than 500 people. Stephen D'Souza has more from Times Square.
It is, of course, one of the main things you do as a tourist when you come to New York City. You book tickets to Broadway to go see a show. Well, as of tonight, that will not be possible for about a month. All Broadway shows have been canceled up until April 12th. This is part of New York State's efforts to limit the spread of the COVID-19 virus. They're trying to institute social distancing, reducing density. Of course, when you have people from all over the world coming to shows like this, that's what you're going to get. So more than 24 shows, including Hamilton, are now canceled. And as you can imagine, there are a lot of disappointed tourists as a result of this.
I was a little disappointed, but we had seen lots of other shows when we were here, and I felt a little lucky that we got to see those.
I was just disappointed, and not just, not for me, but mostly for my kids. My son has asked me to come here for the last year.
I feel worse for the performers. There's a lot of people that had their Broadway debuts like last night, and now they can't, do what they love to do.
It was a little heartbreaking, and I knew an actor who was in the show I was going to be seeing tonight. And I read through an article finding out how all the shows were canceled, and he didn't even get a formal memo yet.
Disappointed. You're in New York City and you want to go to a show, and so it's too bad.
If the stoppage goes until April 12th, this will be the longest shutdown on Broadway since 9/11 and could cost the industry more than $100 million. This comes as New York City declared a state of emergency today over the virus. For theater goers, the news is still somewhat positive. Off-Broadway shows, anything in a theater with less than 500 people, that's still going to be open, though their capacity is going to be reduced by half. This is just one of the latest measures that New York City and many cities across the U.S. are taking to try to contain the spread of the COVID-19 virus. Stephen D'Souza, CBC News, New York.
We told you earlier about a new travel ban on 26 countries in Europe. These latest restrictions have added another layer of uncertainty for travelers, and that's got some of them quickly changing their plans to make sure they can get where they want to go. Katie Simpson has more.
Dulles is the international airport that serves the greater Washington, D.C. area. It's a very busy flight hub, and given all of the concern about coronavirus and travel bans, this place is incredibly calm. You do notice a lot of people wearing face masks, whether they're returning from a flight or heading somewhere, particularly for those international flights. Now, while things are calm and orderly here, there is some frustration among passengers who've had to upend their travel plans because of the changing flight schedules, because of concern about the impact of travel bans, and it's costing them thousands of dollars.
We have to leave now because we are expecting the collapse of the transportation flights, and we are afraid to not go home, so we cancel everything. And I had to pay $2,000 extra for get the ticket for today's flight because I'm expecting there are no more flights to Switzerland after tomorrow.
There is another issue that has come up at American airports, and that has to do with the type of screening that happens when travelers arrive from international destinations. We spoke with a man who traveled from Riyadh here to Washington with his family after their vacation got cut short because of coronavirus, and he describes what it was like in the screening process here at Dulles.
It was pretty casual. I saw, a couple of signs on the, messages on the screen saying if you feel sick, self-quarantine for 2 weeks, but nobody asked us personally anything.
There has been confusion about what the travel ban actually means, and certainly some of the passengers we've been speaking with are concerned about that. And rather than take a risk, many are rebooking flights, trying to get home as quickly as possible rather than risk getting stuck somewhere. Katie Simpson, CBC News, Dulles Airport.
The COVID-19 pandemic gripping Italy has turned once crowded cities into virtual ghost towns. All of the country's 60 million plus people are under lockdown as the government tries to stop the worst coronavirus outbreak outside of Asia. Megan Williams has more from Rome.
Early morning exercise under lockdown. Normally, aerobics instructor Graziella leads a class of 20 inside a nearby gym. She sent a message inviting some to join her outside today, but no one showed up.
Molte sono molto caute.
Italians are allowed in parks to exercise, but the lockdown is still fresh, so people are nervous, she says, about coming out, even with keeping the required distance. Work has been mostly solitary, too, for barista Paola, who until yesterday stood at the counter of a mostly empty cafe in Rome. I just want everyone to pull together, to think about the good of the country, and to stop going out, she said. She got that wish when Prime Minister Giuseppe Conte announced last night that everything but grocery stores, pharmacies, and essential government services would be shut down nationwide. Down the street at the supermarket, shoppers line up, keeping at least 1 meter's distance between them. This shopper says her life has radically changed since the lockdown began on Monday. No more gym or work as a translator. The toughest part, she says, is the unpredictability.
Nobody knows how long it will go on. It will be going on, and so that's the uncertainty, because we don't know.
Work for psychiatrist Walter Procaccio has changed too. Next week, for the first time, he's seeing patients via Skype. And he worries about patients in institutions whose meds he oversees. We're all taking precautions, he says, but if one of them gets infected, with so few care workers, it will be a disaster. Still, he says the coronavirus has brought Italians together as one. As the seriousness of the situation is sinking in all throughout Italy, Italians are now carefully following the decree regulations, hoping to stop the spread further in Italy and also set an example for the rest of the world. Megan Williams, CBC News, Rome.
Next to the test for COVID-19. Whether you go to your own doctor, an ER, or a separate site, the process for finding out whether you have the virus will be the same. Health reporter Christine Burak now with what it takes to confirm COVID.
Canadians are landing in emergency rooms asking if they have COVID-19.
Blue will be at top. Okay.
The University Health Network showed us what happens next, minus the wait.
Hi, so we have a patient with a positive screen named Christine.
The screener shares symptoms and travel history with a nurse who prepares to take a look.
Now, the person that's being screened is supposed to sit about 2 meters from other people that are in the waiting room.
Hi, Christine.
Hi.
Hi, my name is Cherry. I'm one of the nurses here. If you can please follow me.
More questions followed by a quick exam.
So we're going to do your blood pressure.
The information then gets passed on to the doctor.
She or he will decide whether to do a swab or not to test for COVID.
After a quick check, the ER doctor makes the call. A nasal swab goes down the throat or up through the nose.
So if you can pull down your mask.
Okay.
Am I swabbing?
Never had this done before.
Okay. Yes, it's startling, but it's over in a moment.
That's it. It's all done.
The results take 24 hours, but doctors urge people not to just show up in hospital.
We need to be very careful about is not overburdening the departments so that we can still look after the very sick people.
Staff are also preparing for those scenarios.
We also have been really running drills on the worst case scenario, which is that if a patient comes in with COVID-19 and is in a cardiac arrest situation.
If we could get some intubation medications.
It's a mannequin, but in case you missed it, it exhaled, spraying workers like a patient. Afterwards, UV light reveals how far germs can travel.
It's stressful. yeah, it's very stressful and anxiety provoking.
Reminding everyone as this outbreak evolves, proper precautions must be taken by healthcare workers and patients alike. Christine Birak, CBC News, Toronto.
If you're still curious for more, we have a lot more coverage of the coronavirus pandemic online, including this video debunking some myths around coronavirus protection. And you can find it all at cbc.ca/Toronto. Stay with us. We'll be right back. Colette Kennedy is back again. And Colette, I know we were talking about a little bit of wind tomorrow, but at least some sun, right?
Yes, you're right. Late in the day, Chris, we should see some sun coming out. And you know when I'm hoping we're going to have sun as well is a week from today. I wanted to give you some good news because guess what? A week from today, next Thursday, spring arrives. Not tonight, it's next Thursday, but that's what we'll be saying on Thursday. Just give it a few days. Now, back to something a little more serious. We do have some weather statements just in place to let you know about the stronger winds, the areas you see here in blue where the winds will be gusting over 60 kilometers an hour, and also to the east because of some of the rains that are going to push through, 15 to 25 millimeters. A wind warning as well, that's towards Picton where the winds may exceed 90 kilometers an hour. Well, what's happening for us in the GTA and how is the system affecting us? For now, the temperature at 5 degrees, but it's going to be a scenario where we're actually going to see our high as we go towards Friday tomorrow morning. So the temperature will rise overnight tonight. We do obviously have some precipitation that is headed our way. We're going to see some isolated showers in the late evening hours, but then it fills in, a couple of systems kind of marrying together, and it fills in more as we get after midnight. We see the rain that will push through. As it goes through, though, that warm front, that's what brings those winds from the southwest, our temperature up tomorrow morning. It's mild. The early part of the commute, maybe a little bit on the wet side, and then the cold front goes through and the temperatures start to fall, things dry out. That's where we get some of Chris's sun into the afternoon hours, but it becomes windy as well. So we're going to hang on to those strong winds. For the GTA, it's going to be 40, 50, even 60 kilometers an hour with some of those gusts, and we'll see those kind of through the day, and then they will ease as we get towards Friday night, towards Saturday. It's a bit of a battle, high pressure to the north and the system to the south of us as we go into Saturday. So for the start of the weekend, we should be in the sun, but southwestern Ontario into more cloud cover, and then high pressure winds out Sunday, and starts to change on Monday, but it means Sunday is going to be a sunny day if you're looking ahead towards the weekend. A look overnight tonight, those temps rising then. These are the numbers you're going to see tomorrow morning with some wet conditions early. Then the temperatures fall through the day, and we could get a little bit of a mix to the north of us. As for what's going on with the forecast beyond the weekend, we do cool down, so some cooler air this weekend, but you see that we then ride up again as we go towards Tuesday, Chris. So the temperatures will rebound there as we're getting closer to spring.
I want to trademark Chris's son.
You do want a Chris's son? Hey, you can. It's all for you.
Thanks, Colette.
You're welcome.
This weather update is brought to you by Fairmont Le Chateau Frontenac, the best location for your next spring break getaway in Quebec City.
After the break, the Daily Bread Food Bank tries out delivery, how the Red Cross is helping bridge a gap for those who can't get to a food bank or cook their own meals. That story is coming right up. Food banks are there for people who can't afford to buy groceries, but some low-income people can't easily get to a food bank or cook their own meals. Lorenda Redekop has more on a pilot project that's trying to bridge that gap, and it could serve as a blueprint for COVID-19 planning.
It's fish on the menu at the Daily Bread Food Bank's kitchen. Some of these meals will be frozen, then sent out to clients of the Red Cross. The two organizations saw a gap in terms of who they've been able to support.
Somebody who has most likely a mobility issue, a significant mobility issue, somebody who might be socially isolated.
It's a 6-month pilot project sending out 2,000 meals a month.
People who don't normally access food banks, whether that's due to mental health or disability or age, unable to open tins.
This project started at the beginning of January. We spoke with somebody who uses the service to see how it's going.
Paul says he receives one frozen dinner with his weekly grocery delivery. He's legally blind and has other health issues. We've agreed not to use his last name.
I cannot lift a lot. For me to go to a food bank, it might be difficult because it gets short of breath. You know, for people that are on low incomes, it's a tremendous help.
The Daily Bread CEO says today the organization worked on COVID-19 contingency plans, and the ideas from this program could help using deliveries.
We're going directly to people who are experiencing poverty. And so they're not coming into a larger grouping of individuals who are at a food bank. And so that might be of benefit to some who are quarantined or self-quarantined.
This volunteer, who's also a nursing student, sees the advantages.
Yeah, especially with right now. I mean, I'm sure there's quite a few people who are stuck. You know, if you're immunocompromised, right now you're probably not really leaving much.
The Daily Bread expects many more people will want to be a part of this. Once the pilot finishes, they'll look at possible expansion. Lorenda Redicop, CBC News, Toronto.
Coming up, our conversation with the new conductor in residence at the National Ballet about making the unprecedented leap from center stage to the orchestra pit.
I would be wearing a tutu or a dress or whatever and point shoes. I would just walk 15 meters to the next door and peek into the rehearsal room. Staatskapelle Berlin was rehearsing there. And I was just very lucky that absolutely every conductor who I had approached would always be very helpful.
Trauma Care.
Maria Selitskaya performed with ballet companies across Europe, and now she's on the other side of the curtain as conductor in residence for the National Ballet of Canada. She'll lead the orchestra for select performances of Romeo and Juliet, and we sat in on one of her rehearsals.
Because it sounds like a cacophony, it's a massive collage of sounds. I have my game, which I do actually since I was a dancer. I try to take one instrument which practices, and I try to understand where exactly in the score that is played. Good afternoon. It's a pleasure to be here again. Ballet dancers adore orchestra. They adore musicians. They love dancing to live music. Every time when dancers come on stage for the first time after weeks of rehearsing piece with piano, it feels like an ecstasy. I had injured myself very quickly, fairly in the beginning of the season, and so I was hanging around the corridors. It was a very unhappy face. And company was doing Nutcracker at that time. And I always loved this music. I ended up talking to one of violinists from the orchestra, and I said the phrase, I would pay 2 years of my life to once stand in front of the orchestra, wave my hands, because I cannot play an orchestra instrument, but I would love to be part of Nutcracker. And he didn't laugh at me. He turned towards me and he said, why don't you become a conductor for ballet? You're a dancer, and we all know that you're playing piano here until midnight every day. And I said, no way. For dancers, in general, musicians are half gods and conductors are gods. Every break that I had, I would just walk 15 meters to the next door and peek into the rehearsal room. Staatskapelle Berlin was rehearsing there. And I was just very lucky that absolutely every conductor who I had approached would always be very helpful. It looked literally like this, that I would be wearing a tutu or a dress or whatever in point shoes, run to a conductor after performance, and say, oh, maestro, by the way, may I have 5 minutes?
Same kind of beat.
Have you ever heard of a former dancer who has gone on to conduct a ballet orchestra?
Never. Never. No. The education had been informal, not formal, but it doesn't matter because every conductor has to find his or her own path. There's no program that one can go to that will give you all of the pieces. So she had just gone about it a little bit differently.
Frankly speaking, I think I got more private coaching in my years of training than every conductor, probably young conductor these days, because there's a class in conservatory and there are 6 or 7 students and there's just one teacher. I had a teacher who would sit with me up to 3 hours. It's a lot, and he didn't take a penny for it. I'm lucky. I always say I'm lucky. So I feel like I have to just be grateful and do my best. I always feel that I have to prove, to repay him his effort by succeeding.
Exciting to see an accomplishment like that.
Yeah, female conductors at the Oscars this year. We had a female conductor too. Very cool.
Great. And one last look at the weather.
Yeah, so some things changing overnight tonight. Rain showers moving in through the overnight. The temperature actually rising. So we hit our high for Friday in the morning around 8 degrees, and then we dry out and start to clear out, but a very windy day on tap as well, Chris.
March is always unpredictable, right?
Yeah, this is how it is. It's this up-down as we head towards the first day of spring next Thursday.
Sounds good. And that is our show for tonight. Have a great night.